My dear students, today I would be taking up first of the cranial nerves, and this topic happens to be very important from your examination viewpoint as usual. So as far as the first cranial nerve is concerned, we give it the name as olfactory nerve. I will be discussing things about olfactory nerve as far as its surgical anatomy is concerned, as far as its course is concerned, and as far as its clinical implications are concerned, which are frequently asked in head and neck surgery, ENT, and other surgical branches. Now, I would be going systematically first about the origin of the olfactory nerve, then the various places it travels, and the functional significance of these places which we come across. So having a look at the board, you can just see that the topic of the today is olfactory nerve. And olfactory nerve over here is a figure which shows the olfactory mucosa and the inside of the nose. So as far as the nose is concerned, you can see that there is a very important area, the nasal cavity, and in the nasal cavity there is the olfactory mucosa, and from the olfactory mucosa there are small nerve fibers which go up towards the base of the skull in the anterior cranial fossa, a special area of the bone which we call as cribriform plate of ethmoid. So cribriform plate of ethmoid is in continuation with the nose, and from the nasal mucosa, especially the upper part, nerve fibers go up and they reach to the cribriform plate of the ethmoid bone. We call this cribriform plate of ethmoid because it has got seal-like holes inside it, and through these small holes pass the nerve fibers up into the anterior cranial fossa. So this figure shows you the description of the nerve fibers passing through small holes as shown by arrows while I move my cursor. So this is the upper part of the nasal mucosa, and from here small nerve fibers going up shown by arrows, and there is something in the form of an olfactory bulb which we can see. Having a look at the figure number 2, you can see now that this is the basal surface of the brain, the base of the brain, and here it would be in relation to the anterior cranial fossa, and there is a projection which we give the name as olfactory bulb, and from the olfactory bulb goes down the olfactory tract, and the olfactory tract is important because it then goes in relation to the olfactory tract, which further divides into two branches, the medial and the lateral olfactory stria. So the medial and the lateral olfactory stria are projections from the continuation of the olfactory tract. Now, so we have the olfactory mucosa, then we have the olfactory nerve fibers, then we have the olfactory bulb, and then we have the olfactory tract and the medial and the lateral olfactory stria. Eventually, they have to go into some center of the brain. The way we have the visual center, the way we have the auditory center, the speech center, in a similar manner, we have the olfactory center. And the olfactory center is represented by two important areas, which we give the name as periamygdaloid and prepiriform areas. So periamygdaloid and prepiriform areas lie within the area of the cortex, which we give the name as entorhinal area. So the entorhinal area is the primary olfactory area, which is the seat of olfaction, the center of olfaction. This whole represents the course of the olfactory nerve from its beginning to the termination. Now, is there anything else important about the olfactory nerve? Basically, I was going through the last year's NEET Pg questions, and I could see this diagram over here. The question simply wanted a student to answer which is the olfactory center. The olfactory nerve is showing, the olfactory bulb is showing, and then olfactory tract is showing, the cribriform plate is shown, and this is the area in the blue box, and the blue box was to name which is the olfactory center. So the olfactory center is the prepiriform and the periamygdaloid area, which was shown as options in the question. So this happens to be a nerve of importance and recently asked as well. Now, is there anything important about the olfactory nerve? I guess yes, there's a lot of importance attached to olfactory nerve as far as the disturbances in olfaction are concerned. So the disturbances in olfaction, as you can have a look at the board as well, I have shown disorders of olfaction. Now you can focus your attention towards me again from the board. And disorders of olfaction, what would we mean? Basically, we can lose the taste of olfaction, we can lose the sensation of olfaction, or we can get an altered sensation of olfaction. And important, simple viral infections can be a cause of loss of olfaction. Nowadays, coronavirus, many cases seem to present with multiple and diverse symptomatology or signs, and loss of olfaction can be one of the signs of recently diagnosed COVID-19 or coronavirus infection. In addition to already existing viral infections, lots of them. There are lots of already existing nasal infections due to viruses, and they cause loss of olfaction. Allergic rhinitis, sinusitis, they have been found to cause alteration in olfaction. Now, in addition to these viral infections and upper respiratory tract infections which can cause altered olfaction, the loss of olfaction is also considered significantly important in neurology, because many neurological diseases can present with loss of olfaction. Diseases like Parkinsonism, diseases like multiple sclerosis, diseases like Huntington's chorea have also been shown to have this altered sensation. In addition to this, specifically speaking about neurosurgery, we can have meningiomas, especially in the frontal lobe of the brain. And as I showed you in the figure, that the olfactory bulb and the olfactory tract lies in relation to the frontal lobe of the brain. Sometimes the frontal lobe meningiomas, especially, there can be other frontal lobe tumors, but frontal lobe meningiomas are very common, and they can compress upon or press upon the olfactory pathway and cause loss of olfaction. So this neurosurgical entity in the form of frontal lobe meningiomas can cause loss of olfaction. So this is something I, from my experience, could just get an idea about olfaction, olfactory tract, olfactory pathway, and some of the important clinical conditions associated with it. And I guess that for an MBBS PG student, it is more than sufficient to remember the points I have just now enumerated. Thanks a lot.